Hi, welcome to our 8th discussion board. So we've been at this now for a week and a half. We have now the 8th, the ninth, and the 10th, so the last 3 discussion boards. First of all, I'd like to say that I am just so super impressed. The vast majority of students have actually stuck with and done these discussion boards every single day. So number one, fantastic job of setting up a routine, sticking with something. I'm hoping that this has done 2 things. Number one, help lower your anxiety about what it's like to be in an online environment, because next Monday, all your classes are going to be in this online environment. So hopefully this has gotten you in the habit of doing discussion boards and looking at videos. And so for those of you that hadn't had a lot of experience with online, hopefully this has helped develop some routine for you in that. Number 2, hopefully this has lowered your anxiety a little bit, because now you've seen that you've got different ways to be able to get some points towards your final grade. So hopefully this has helped you kind of feel like, okay, I can come out of this with a solid grade in these classes. So I'm hoping that that's been beneficial to you. I want to comment today as we go through our last 3 discussion boards. So Monday I asked people to, what would you like to talk about? And I took the responses that came from my science diplomacy class, where they were really asking, what's the end game? What are we looking for here? And then I said to you on Tuesday, okay, why don't you comment on what you think is the end game? And I saw a variety of different comments. It was exceptional. Number one, I'm really glad about how much you're willing to put yourselves out there and share your views. Number 2, you did an awesome job commenting on each other and being supportive and encouraging, so that's great. If you see that there's some discussion boards that I haven't graded yet, no problem. Don't worry about that. I'm working through this process of making sure you get all your grades. So if you notice any problems, just shoot me a mail and I'll hop on and take a look at it. But we've got these last 3 days. And kind of one of the overwhelming things that I saw in questions from folks as I've continued to work through the discussion boards from Monday's questions was and Tuesday's responses was, number one, I saw that there was a little bit of a misconception, a little bit of misunderstanding about what's going on right now, and a little bit of question about like, hey Dan, would you explain some of how you're understanding it and your view on it, and how does this all come together? And then how might we look at responding? And I appreciate that. I appreciate that you view me as a person worthy of trust, who's got some reasonable expert opinions. So let me just give you a quick little background on how I'm viewing this, some personal views on how I'm thinking about it, feeling about it, and then acting on it, and then leave you with your question today, where we're going to talk about how we start to respond. So number one, my degrees are all in biology and environmental engineering applied to biology, and particularly environmental engineering applied to biology and health, and biology and policy. So what that means is that I'm right there in the space of the folks who are dealing with this situation. Now, mine's mostly around bacteria as opposed to viruses, different organisms, so different biology, kind of like you study plants and you study people. They're different organisms, but it's basically biology. And my study of health has been more in the environmental health as opposed to just the public health. But I've had classes, it's funny, I'm watching people and they're talking about, well, I'm getting this epidemiology data from Hopkins. Well, my epidemiology classes and what I then teach to you guys is actually, because I studied epidemiology and biostatistics. Those classes that I have, I took them at Hopkins as well. So lots of people kind of around the country have gone to Johns Hopkins to do some of their basic studies. So that's kind of the background. Now, I am a professional engineer and licensed as a professional engineer, but I'm also licensed as an environmental health specialist. So I am actually a sanitarian, which means that I can also look at and inspect restaurants and nursing homes and food safety and making sure all those things are done properly so that we stop the transmission of illness. And the classes that I teach are modeling so that we understand how do we predict things and look at things and understand things, and advanced microbiology, and so how do we understand these things. So number one, I'm not going to claim that my expertise makes me more knowledgeable than the folks out there that are giving input. But it does give me at least a reasonable basis for understanding what's going on, and a reasonable basis for asking questions when I see things that are talked about on the news or posted on the CDC, and ask, what exactly does that mean, and how do I understand that? So let me kind of explain a couple of things. There seems to be a misconception that our social isolation and our staying inside and maybe staying away from each other and not getting together in large groups for these 2 weeks' time is about stopping the spread of a virus. It's not. It is about slowing the spread of a virus. There's a huge difference between stopping and slowing. Let me give you an analogy. If you're in a car on the interstate going 65, 70 miles an hour, and somebody in front of you slams on their brakes, you can run into them at 70 miles an hour and get all the damage that comes from that. Or you could also put on your brakes and slam into them maybe at 30 or 40 miles an hour, and you'll have the damage that comes from that. There's damage. There's massive damage. Getting in a wreck at 40 miles an hour is massive damage. If you're not wearing a seatbelt and you don't have an airbag to deploy, you're going to be seriously hurt if you hit something at 40 miles an hour. You will be more hurt if you hit something at 70 miles an hour, but slamming on the brakes and doing everything you can to slow yourself down doesn't eliminate the hurt. It does help it some. That's what this 2 weeks is about. The curves are still growing exponential in terms of number of cases. The curves are still growing exponential in terms of number of deaths. We've slammed on the brakes. We are going to have a massive car wreck, but our massive car wreck will be a little bit better. All right? So for those of you that kind of have the perception that we're doing all this stuff for 2 weeks because we're going to have a vaccine in 2 weeks, I'm not trying to throw cold water in your face, but we're not going to have a vaccine in 2 weeks unless something miraculous happens that nobody is currently aware of or talking about in the media. So 2 weeks from now, right, we're in this massive car wreck. Now, we're not going 70, we're going 40. That's good. That's awesome. We've slowed down. And our airbags will deploy, right? Our hospitals are there. We'll have this massive car wreck. There'll be lots of sick people, but there'll be some help, right? We're wearing our seatbelts. We've got our hospitals ready. We've got the airbag to deploy. We've got the emergency systems there. Now, the airbag and seatbelts will probably do a better job of protecting us if we're going 40 miles an hour than if we're going 70 miles an hour. So you see, that's why it was so important that we slow down. So that's great. There's still lots of damage to the vehicle and lots of damage to the person when you're in a car wreck at 40 miles an hour. Now, we might escape from it without much problem, and that'd be awesome. And knock on wood, that's what we're all hoping for. But I want to be really clear. This is a car wreck. We were going 70 miles an hour. We're trying to slow down to 40 as quickly as possible. We've got airbags. We've got seatbelts. There's going to be a car wreck. What does that mean? People are going to be hurt. So let's get our mind around what that looks like. There are going to be people who are sick, and some of those people will die. Now, I'm not trying to be morbid. I'm not trying to throw cold water in your face, but that's the reality. For those of you on one of the discussion boards, you've already seen one of your classmates post, I had a relative die from this disease. Now we are not going to have a funeral. We're not going to see what happens with the body. We're not going to have an opportunity to mourn or come together. And so what does that feel like when somebody passes away and we don't get to process that, right? Mourning is an important part of who we are as people and how we deal with death. And the reality is, if somebody has gone to the hospital and they pass away because they've got a COVID infection, we're not going to turn around and distribute that infected body back into the public to have a giant funeral. It's not going to happen. The number of deaths is going to increase, and there's still not going to be any of these funerals. And so there's going to be increasing numbers of people asking the question, well, but I wasn't there when they died. I didn't get a chance to say goodbye. I don't know how I feel about that. That's not just going to happen to one or two of us, that's going to happen to an increasing number of us. So that's the new norm. That's the reality. Now, deaths occur all the time, right? And I don't mean to be morbid and pass it off, but we have 500,000 deaths from heart disease every year. We have 500,000 deaths from cancer. We have 100,000 deaths from obstructive pulmonary disease, right? So we know what this looks like. We've got about 50,000 deaths a year from things like pneumonia and the flu. Worst case scenario is that we are going to have deaths from this current illness that are 50,000, 100,000, 500,000. The experts' opinions are kind of all over the place, right? Now, worst case experts' opinions are talking about 1 million or more. Best case experts' opinions are talking about like 50,000. Now, there's a huge difference between 50,000, 500,000, 200,000, 1 million. There's a big, big difference in those numbers. The fact is there will be some deaths. Those are tragic. And how we deal with it is our quote-unquote new normal. Let's go back to thinking about this car wreck, right? So the car is going to wreck. It's going to wreck at 40 miles an hour, not 70 miles an hour. We are going to be hurt. The airbags are going to deploy. The seatbelt's going to be on. It's going to do its best job of protecting us, and we are going to be hurt. So our body in the car, that's one of the things that's hurt, right? And we have to deal with that. But the car is also damaged, and we have to deal with that, right? If I said to you, hey, after the car wreck, you need to drive yourself to the hospital, or after the car wreck, you need to have your car so you can keep going to your job. Can you see why we also have to think about the car and the person? Now, we're worried way more about the person than we are the car. But at the end of the day, we still kind of have to think about the car. So the car wreck analogy is a great way to think about what's going on. We're worried about the person who's in the car. We also have a secondary, lower level, but we can't just ignore it. We got to think about the car too. That's kind of like the health system and the economy. We've got to think about what's going on with people, and we've got to prevent as many deaths as we can. But the economy is kind of like our car. If we wreck it, there's kind of like, well, what was the point? If there's kind of no car left after the car wreck, if there's no economy left after this virus comes through, then I don't know, what were we saving everybody for? So this is really tough because there's no question the person is way more valuable than the car. No question. The life saved is a lot more valuable than the dollar. But how many dollars can we afford to lose? And you might say, well, you know what? I would give every single dollar I have to save someone. And that's true. That's the way most of us would operate, right? I mean, money is not as important as people. But here's the practical reality. We're not just talking about a ethical dilemma or some kind of out there in the nebulous space idea. We're talking about the reality of, if I said to you, hey, if you can save this person, I need your last dollar. And you're sitting there with your last dollar in your pocket and you're thinking, what am I going to eat later today if I give you my last dollar? And I'm going to one-up it. I'm not going to guarantee that the last dollar will save the person. I'll tell you, I'll do my best work if you give me your last dollar, but I can't guarantee a good outcome. So if that's the reality, if I say to you, I'm going to do the best I can, we still might have a bad outcome, but one of the things that's for certain, you're going to have no dollars left in your pocket because you paid them all out. And maybe it'll work for the health, but maybe it won't. But you're not going to have any dollars left. Now people's minds start going in a different space. I want to give every last dollar to save somebody. But what if I'm still left with the person not getting better and I have no dollars? Is that really where I want to be? Now, I can say most of us, we can talk about this and we can say, yeah, I don't know. I would give my last dollar even if there was just a chance of saving somebody. And that's true. Most of us, we would jump into the burning building to save a person, right? The question is, would we jump into a burning building to save a stranger? Or if there were 10 people at the top of the burning building and it was 10 stories high and there was no way we could rush up to get them, would we be the 11th person that died in the building, right? Now, again, I'm not trying to throw cold water in your face. I'm saying we're going from the specific situation of how do you take care of people right around you to the more generic situation of how do we take care of each other as society. And when people get disconnected, when things become what's far away from them from what's right next to them, their motivation, their behaviors, their attitudes change around those. They start asking difficult questions. So that's the situation that the United States finds itself in. So let's be really clear. Here's the reality. We're in a car. We're going to have a car wreck. We're slowing down from 70 miles an hour to 40 miles an hour. We're wearing our seatbelt. We've got out our airbag. We're worried 100% about the person. We've got in the back of our mind that we need to think about the car also. So we're going to decide kind of how this wreck is going to occur and how quickly we move past the wreck, but that's the reality, right? Now, talking about a vaccine 18 months from now, that we do a better job driving, that we take a driver's ed course, that our next car has better airbags and better seat belts, doing an analysis of what happened on the road, figuring out how to design roads better, thinking about better speed limits in the future. These are all over the horizon and all things we've got to be thinking about. We also need to be practical and understand the reality of the situation we've got right here in front of us. So, today's question for the discussion board, right? Let's start not in our head. Let's not start in our hands. Let's start in our heart. Let's start with a feeling. When you have somebody around you who's going to get sick, and you have somebody around you who might possibly pass away from what we're dealing with, what we've got on the horizon, how are you going to feel about that? How are you going to feel when somebody's passed away and you didn't have an opportunity to say goodbye? How are you going to feel when we see increasing number of funerals and we don't have an opportunity to participate in them? Let's be honest. Let's share. Let's talk through on the discussion board how that's going to make us feel. Not trying to be morbid. Not trying to throw cold water on your face early in the morning. Not trying to ruin all the good we've done from this discussion board. I'm trying to move us into the space of starting next week. We're going to continue in our online classes. We want to keep making progress in our education. And we want to deal with the situation that we've got around us. So today's discussion board number 8, is for you to talk about how you think you'll feel, how you're going to feel, how you would feel if somebody said to you, hey, somebody in your family went to the hospital thinking they were sick and they've passed away and we can't get together to have a funeral for them, or we can't return their body to be able to have a funeral, or we're not going to have a funeral, or you didn't get your chance to say goodbye, or you weren't expecting this to happen, but it did happen. How are you going to feel about that situation? Please take some time to share. Please take a time to comment on your colleagues. Let's support each other. Let's be good listeners to each other. And let's move through these last discussion boards together. Thank you.